So lenalidomide is a drug that is effective in CLL but is not very widely used. So this study was actually one that was started at our institution over 10 years ago. Actually started before I was even at Ohio State. And while I'm currently the principal investigator, this is a long-term study that's actually a National Cancer Institute CTEP sponsored trial. And the original intent of the study was to take people with CLL who had at least one high-risk feature, such as IGHV mutated status or deletion 17p, who you know are going to need treatment, in the nearer term. So not the group of people with a molecular profile of their CLL we expect they may never need treatment or need it a decade later. And to treat them with lenalidomide or intervene at a point when they haven't had the disease as long and haven't needed treatment yet, with a goal of trying to improve immunity. So in people with CLL, just the duration of CLL decreases in immune globulin levels, it dysregulates T cells, so it really causes an altered immunity, and the longer you've had CLL, the more severe the impact. So the question is, can you intervene with lenalidomide early in patients that you know will need treatment eventually and have an impact on the immune system? And it was actually randomized to lenalidomide and pneumococcal vaccines, or pneumococcal vaccines then starting lenalidomide, with the primary endpoint of looking at vaccine serologic response. So that was actually reported some time ago, and there was no difference between the two arms, disappointingly. However, recently we've realized that we've actually had patients in very long follow-up in this study. Because the study, again, it was over 10 years ago that it was started. And so we wanted to report the experience of patients who had been taking lenalidomide as an early intervention long-term and what happened to them. So the abstract includes data on progression-free survival and time to next treatment. That's kind of broken down by reason for stopping lenalidomide, like did they progress on it or not. That is kind of interesting to go through. Makes a lot of sense. So you see higher risk patients don't have as much benefit as those that don't have things like deletion 17p. But there are patients that had very durable benefit. And then I was also interested in the longer term impact on the immune system, because the vaccine responses were studied during the first months of treatment. And so the question there is, do you see, higher grade infections, like more serious infections decrease? What happens with second cancers? Does it increase the risk or decrease the risk? Because people living with CLL already have a higher risk of other cancers. So we report the rates of those, which really do not seem at all out of keeping for what you'd expect. So I think this really supports that this extended lenalidomide is not really increasing the risk of other cancers substantially. I don't know that it's reducing it, but it's certainly not something that seems to be dangerous there. And we did kind of ad hoc analysis looking at infections that were grade 3 or greater, and then people who had a shorter exposure to lenalidomide versus like a year's exposure. And actually it was done by quartiles. So people who had the shortest quartile exposure and then people who had like the longer quartiles, there's actually a lower incidence rate of infections for people that had the longer exposure. So that could be people had infections and discontinued, but it really supports that extended exposure to lenalidomide isn't really making this devastating in terms of infections, and maybe is supporting some degree of immunity. And these are serious infections, so they're not, like urinary tract infections that didn't lead to a hospital stay, or viral upper respiratory infections that didn't lead to people seeking medical care. These are infections that led to people being hospitalized. So I think it's a really nice opportunity to just look at the long-term picture for people who participated in this original study, to see kind of what the longer-term effects of this lenalidomide strategy is. And I will say the overall survival was quite favorable.